Hello everyone. Today, we delve into the domain of a medication known as Sympazan. Just as with our previous discussions, our aim is to educate. Should you have health-related questions or uncertainties, please contact a medical expert. Description: Sympazan, known scientifically as Clobazam, is an oral film primarily used to manage seizures caused by Lennox-Gastaut syndrome, a severe form of childhood epilepsy that also causes developmental delays. Sympazan works as an antiepileptic drug and belongs to the benzodiazepine class of drugs. It functions by affecting chemicals in the brain that may be unbalanced in individuals with anxiety or seizures. It is prescribed to both children, age 2 and older, as well as adults. Warnings: taking Sympazan does come with potential risks. It may cause life-threatening addiction and withdrawal symptoms, especially if used for a long period or in high doses. Stopping Sympazan suddenly or reducing the dose too quickly may result in seizures. It's essential to follow your doctor's directions about tapering your dose. Additionally, taking benzodiazepines, including Sympazan, may increase the risk of suicidal thoughts or behaviors. Therefore, any new or worsening symptoms of depression, unusual changes in mood or behavior, or thoughts about self-harm must be reported to a medical professional immediately. Before taking this medicine. Before commencing treatment with Sympazan, certain aspects need consideration. Inform your healthcare provider if you have any allergies or have had any reactions to similar drugs in the past. If you have liver disease, kidney disease, lung disease, or respiratory problems, glaucoma, depression, or a history of drug or alcohol addiction, it's essential to discuss these with your doctor. Also, if you're pregnant, intending to become pregnant, or are breastfeeding, you should consult your healthcare provider due to potential risks to the baby. Side effects: like all medicines, Sympazan might lead to side effects. Common ones include dizziness, drowsiness, feeling tired, coordination problems, and aggressive behavior. These are not all the possible side effects, and you should reach out to your healthcare provider if any unusual symptoms arise. Some serious side effects of Sympazan include worsening of seizures, severe skin reactions, withdrawal symptoms upon discontinuation, and physical dependence. There's also the risk of respiratory depression, especially if used in combination with other drugs that depress the central nervous system. Always ensure that you are vigilant about any potential symptoms and consult your doctor immediately if you notice any concerns. Interactions: Sympazan can interact with other medications. Therefore, it's crucial to inform your healthcare provider about any other drugs, supplements, or herbal products you are taking. Combining it with alcohol or other drugs that depress the CNS can exacerbate side effects and be potentially life-threatening. Dosage: adhering to the prescribed dosage is essential for the efficacy and safety of the medication. Your doctor will provide instructions on how to use Sympazan. Regular checkups are necessary to monitor the drug's impact and to make any necessary adjustments to the dosage. It's important to note that you should not change or stop your medication without consulting your healthcare provider. Avoid: it's advisable to avoid alcohol while on Sympazan as it can increase drowsiness and dizziness. Given the potential for side effects, operating machinery or doing any activity requiring alertness should be done with caution. FAQ: a common question is whether Sympazan can be taken by children. Sympazan is approved for use in children age 2 and older but should always be administered under the supervision and guidance of a healthcare professional. Closing: this concludes our overview of Sympazan. Remember, this information is meant to provide an insight, and should not replace medical advice from professionals. Always consult with your healthcare provider for any specific concerns or questions. Thank you for joining us.